Hello everyone and welcome back to my YouTube channel. So for today's video, I will be discussing to you the history and origin of post-traumatic stress disorder or PTSD. But before I start, let me first define what PTSD. PTSD is defined as a mental health condition characterized of being exposed to traumatic events, experiencing intrusive symptoms, frequent avoidance, negative changes in thoughts, and changes in arousal. Let's go to history. Year 1761, Dr. Joseph Leopold wrote Nostalgia among soldiers, which characterized by exposure to military trauma, sleeping problems, and anxiety. In same year, Dr. Jacob da Costa studied Civil War soldiers with cardiac symptoms, or also known as the Costa syndrome. Year 1865, there are some thoughts that physical injuries could lead to PTSD symptoms, and that was supported by the Railway Spine Report. Year 1914, which is also World War One, there are various treatments used for trauma. Like with European hospital, they're using hydrotherapy and electrotherapy. Year 1919, during this year, symptoms of PTSD are called shell shock. Like trauma are caused by reaction to the explosion, while there are soldiers who had not been exposed to explosion but had similar symptoms are tagged as war neurosis. Year 1939, which is also World War II, shell shock was replaced by combat stress reaction or battle fatigue, and it's characterized by soldiers being battle weary and exhausted. Same year, trauma cases were treated using proximity, immediacy, and expectancy or PI, which reduces delay for fast recovery. Year 1952, American Psychiatric Association produced the first diagnostic statistical manual of mental disorder that includes gross stress reaction, which characterized by being normal but had symptoms of dramatic events. Year 1968, gross stress disorder was removed in the second edition of DSM or DSM-2 and was replaced by Adjustment React to Adult Life. Year 1970, Vietnam War and women's movement brought the biggest evolution in the diagnosis and treatment of PTSD. And year 1980, APA added PTSD in DSM-3. 1987, PTSD criteria was revised in DSM-3R. And the year 2000, DSM-4-TR requires the individual to respond to trauma with intense fear, helplessness, and horror to consider post-traumatic stress disorder. And year 2013, DSM-5 moved PTSD from anxiety disorder category to a new category of disorder referred to as trauma and stress related disorder.